Good afternoon. I'm very honored to be at your service for today's lecture. I was assigned with the topic of larynx and the diseases of the larynx. And by the way, I am Bernabe Mendoza, currently the chairman of ENT Head and Neck section of Ear, Nose, and Throat Head and Neck Surgery in Northern Mindanao Medical Center. Again, I'm very glad that I was able to be at your service for this afternoon. Now, my topic larynx lies anterior to the neck. It is opposite to the cervical vertebra and extends from the base of the tongue to the proximal portion of the trachea. And that this larynx is actually suspended from the hyoid bone by the medial and lateral thyrohyoid membrane. Now, larynx is actually divided into three parts: supraglottis, the glottis, and the subglottis. Subglottis starts from the tip of the epiglottis down to the ventricle. The glottis starts just inferior to the ventricle and to the vibrating surface of the true vocal cord, including the arytenoids. The subglottis area begins at about 5 millimeter below the edge of the true vocal cord, down extends to the inferior margin of the cricoid cartilage. It is shown here in the diagram. This is the superior part, supraglottis, up to the level of the ventricle, the true vocal cord, which is the glottis, and just inferior to the glottis, about 1 centimeter of it is actually the subglottis. Okay. Now there are variations in sizes in males and in females, but until the puberty, more or less the larynx is more or less the same. But however, there is still some peculiarities in the shape of the cartilage, especially for the males, which the thyroid cartilage is more protuberant, and that's what we call Adam's apple. I like to go back to the skeleton or the framework of the larynx. Let's start with the hyoid bone. This is the superior part, which is all of the larynx actually suspended. And this is the only bone per se, but sometimes the cricoid cartilage can become also the bone of the larynx, which is just inferior. Meaning to say, it is suspended up from the hyoid bone and the cricoid cartilage in the inferior part. As I've said, it's the hyoid bone is a U-shaped structures, which is just like, which seems like a crown with thorns. You can see it in the structures here, and there are thorns of it, thorns like that. That's the thorn, parang sungay. This one is the thorn, and this one is the thorn also, which we call it the corno, no, which is the posterior superior corno. Later on we will discuss why it is so important for us, why we have to emphasize a little things like that. Now, there are also major cartilages of the skeleton of the larynx, namely the thyroid cartilage here and arytenoids, which is located posterior to this area, at the thyroid cartilage, and of course inferiorly the cricoid cartilage. Thyroid cartilage is actually the largest, which the vocal cord attached to it anteriorly in the inner side and ends posteriorly to be anchored at the arytenoids. The arytenoids is the moving parts of the larynx. Not shown here, but it is later on. We will discuss it later. And it atop of the posterior rim of the cricoid cartilage and articulate via the shallow ball and socket joints, as we later on discuss. And again, the cricoid cartilage. This is the only complete ring in the structures, and it is just like it is just like a signet ring in appearance. Moving on. Again, I like to talk back. There are 3 unpaired and there are 3 paired cartilages of the larynx. As you can see it in the demonstration, this is the head part, this is the torso, the breast, and this is the pelvis part. You can just imagine the structures, no? So, para di mo malimot, this is the unpaired part. Namely, again, epiglottis, thyroid cartilage, and the cricoid cartilage. So, those are the main cartilages which are unpaired. Again, the only bone is the hyoid bone. If you reflect it, it is in the superior part. It forms the U-shaped structures, as I said ganina, na isungay. So that is the hyoid bone. Okay? Although there are also a little kernel, as we discuss later on, the thyroid cartilage. We will elaborate this later on. There are also what we call paired cartilage. The paired cartilage is actually located at the belly of these structures. Okay? So, madaling matandaan because you can now imagine a human being being represented by these structures. Okay? So, the paired cartilage is actually dalawa kasi paired man. So, from the bottom, this is arytenoid, and going up, corniculate and the cuneiform. You can see it in the in the drawing, in the drawing. Yes. Next slide. Gland. Now here, this is the area of the thyroid gland. Now, and so this is the area of the cricoid cartilage here. Okay. So again, going back to the paired cartilage, this is located at the back. The arytenoid, the corniculate, and the cuneiform. You can see now. You can see better now. Okay? You can see better now. Arytenoid, the top, going up, corniculate, and the cuneiform. So that is now the paired cartilage. Okay? Now, as we try to elaborate further of the thyroid cartilage, the thyroid cartilage has a body or the ala, there is a notch there, and there is a superior and inferior cornu. Again, I would like to emphasize this. The superior cornu is the clinical significance is that you have to palpate that in order for you to block the superior laryngeal nerve for your laryngeal block. So you have to palpate the area, and in that area, that is where your nerve has to exit, especially the superior laryngeal nerve, wherein there is an external and internal branch of it. The inferior cornu is also the area where you can also locate the recurrent laryngeal nerve. So those are of significance, okay? In terms of other anatomical relation. Now, that is the thyroid cartilage. Now, the cricoid, as I mentioned, it is a complete ring, which is the pelvis of our structure. We have some of the structures that attach to it, and there is an articulation facet for the arytenoids and the superior part. Okay, you can see that. My hands is not moving, but that's the facet for the articulation for the arytenoids. And inferiorly, you have the articulation for the horn of your thyroid cartilage. Yes, just inferiorly. This is not moving. Okay, it's not moving. But anyway, yeah, so that's the facet for articulation for the inferior horn of the thyroid cartilage, wherein that is also uh, where your more or less the recurrent laryngeal nerve uh, is to be located. Now, the paired cartilage are actually the corniculate, cuneiform, and the arytenoid. Now, this is the structure. This is how we're going to do it. Now, when you say this is actually the arytenoid, okay? Going up, corniculate, and the cuneiform, okay? Going up. So, arytenoid, going up, corniculate, and the cuneiform, okay? So, this is in relation posteriorly to your thyroid cartilage. Okay, that is at more or less at the back. Now, I'd like you to be aware that this is what we look during the indirect or direct laryngoscopy that we are going to examine in every patient that is coming to us with a voice problem or any problem pertaining to the larynx. This is the representation of the direct mirror examination. So the dental mirror actually what we are using is actually a circle, and it is represented here by different structures. First is the epiglottis, is the anterior part. Okay, the ventricle, the true vocal cord going posteriorly, the glottis or the opening of the larynx, and the arytenoids going posteriorly. Now, at the back of the larynx is actually the opening of your esophagus, this area. Okay, yeah, it's not moving. This area is the esophagus. Okay, so this is what we are going to see during our direct laryngeal examination or indirect laryngeal examination. Okay, this is very important for you to do, especially as the ENT, again when you're facing with patient having trouble with the voice. Okay, now we're going to the muscle of the larynx. There are two types, the intrinsic and the extrinsic muscle of the larynx. Okay, so the extrinsic muscle are divided into actually superior and inferior part. Depressor and the uh, uh, depressor and the opposite of depressor is actually the uh, lift, how do you call it? But anyway, let's start with the extrinsic muscle. Okay, the depressor part. It is best shown in the drawing here. Sternohyoid. Meaning to say from sternum to the hyoid bone. Okay? Another one is the thyroid hyoid muscle. Also here and a bit lateral. And again, the omohyoid. This one is the omohyoid. The small one. My cursor is not really that moving, you know. Yeah. I don't know where is it. Anyway, so those are the depressor part. We're going to the the muscle that will exert cephalad. Okay. So actually, there are elevators of primary or secondary elevators of the larynx. This one is actually here is in the drawing is actually uh, the secondary, because this is from the outer part of the larynx. Okay, if I have to move the cursor here, that is the genuhyoid. Okay, anterior belly of the digastric is also one of the elevators of the larynx. Mylohyoid is not, my cursor is not moving. Okay, again, mylohyoid, genuhyoid, anterior belly of the digastric, and the stylohyoid muscle. So these are the secondary elevators of the larynx. Sorry for that interruption. Going back to the intrinsic muscle, the secondary elevators is actually the fence or the outer part of the larynx. Again, namely genuhyoid, the anterior belly of the digastric, mylohyoid, and stylohyoid. So more or less that forms now the outer covering of the larynx. Now the primary elevators actually the following: stylopharyngeus, stylopharyngeus, I said, salpingopharyngeus, palatopharyngeus, and the thyrohyoid muscles. Those are the primary elevators of the larynx. It is more or less inside already in the larynx. Now we can actually discuss that later on. Okay. Now, again, the intrinsic muscle. It is going back the thyroarytenoid, the lateral cricoarytenoid. Now in this drawing, thyroarytenoid, where is it? This is the thyroarytenoid. Now remember, the thyroarytenoid has also a muscular portion and the mucosal portion, or the buccalis and the membranous portion of the thyroarytenoid muscle. So this is number one, thyroid anteriorly, arytenoid at the back here. Okay, this is the muscle. Second muscle of the intrinsic laryngeal muscle is the lateral cricothyroid muscle. This is, as you said, this is lateral. So as the name implies, it is in the lateral side. Okay, again, my cursor is not really moving. But another muscle is the interarytenoid muscle. Just posterior to it is the anterior arytenoid muscle. And lastly, the posterior cricoarytenoid muscle. So those are the intrinsic laryngeal muscle. Okay? Now, I like to discuss further of the arytenoid because this is the one that really functions as to how we're going to produce the voice to protect the protection of the larynx. So this is actually a simple toy as in joystick. When you move the joystick in, out, up, backward, so this is the joystick. This is the arytenoid. So anteriorly, you have the thyroarytenoid muscle. At the back, you have the posterior cricoarytenoid muscle. So those are the two main character of this muscle that is attached to the arytenoid. Okay, so this one, as the drawing implies, this is the posterior cricoarytenoid. So it will abduct. Meaning to say abduct, it will open the vocal cord. Okay, as in you inspire, the vocal cord open. So this is the function of the posterior cricoarytenoid muscle. Okay, when it has to be closed, it is now the function of the thyroarytenoid muscle. Can you imagine now the joystick that going I am seeing you, excuse me again, excuse me. Now again, the arytenoid is the joystick. Now when you turn up and down, lateral side, so this is the joystick. Of course, in the joystick, you also have the cuneiform and the corniculate. There at the top, you can see that. Okay? Again, the main character of this thyroarytenoid is the or thyroarytenoid muscle is to pull that muscle. But before that, we will discuss the lateral cricoarytenoid, lateral cricoarytenoid muscle, which is located at the back, at the side. This is the muscle that adduct also. The only one muscle that will abduct is actually the posterior cricoarytenoid. As you can see it in the drawing, it is at the posterior, pulling up the joystick at the back, open up the muscle. That is only the muscle that will abduct. The other one actually is going to adduct the true vocal cord. Okay? So this one is the lateral cricoarytenoid muscle. This is at the side. So when it contracts, it closes the vocal cord. Simply as that. Okay? Okay? Now, the thyroarytenoid muscle is also going to length or tense and adduct the vocal cord. Now, in this drawing here, at this pointer, this is the buccalis and the muscular portion of the thyroarytenoid muscle. Okay? So this is now that forms the true vocal cord. Okay? Can you follow? So thyroarytenoid. Yan. The portion of it, at the medial portion, is actually the vocalis and the muscular portion of the thyroarytenoid muscle. So this forms now, the vocalis muscle forms the bulk of your true vocal cord because there is the vibrating surface of that particular muscle now producing the voice. Okay? Cricothyroid. Okay? Can you imagine now? So cricothyroid is at the side of the skeleton. This one is the side. This one is at the side. So this, okay? Now, moving on to uh, the nerve supply. The nerve supply of the larynx is actually coming from the vagus nerve. Okay? From the vagus nerve, it goes with it the superior laryngeal nerve at the superior part. Okay? Then, it gives off the internal and the external branch of the superior laryngeal nerve. Can you imagine the superior corno of your thyroid cartilage, as I mentioned kanina, as well as the hyoid bone, okay? The hyoid bone at the corno of the hyoid bone, the crown, I discussed earlier. And that is where in between your superior corno of your hyoid bone and the superior corno of your thyroid cartilage are actually the thyrohyoid membrane, wherein that is where your superior laryngeal nerves enter. One goes inside the internal branch, one goes outside, and the outside goes to the cricothyroid muscle. Okay? Okay, can you follow? Now, the recurrent laryngeal nerve also coming from the vagus nerves, all the intrinsic muscle of the larynx are actually supplied by this recurrent laryngeal nerve. Okay? Can you follow? So this is the recurrent laryngeal nerve here. It goes inside. And here, from the vagus, it goes inside. So that is the recurrent laryngeal nerve. Now, it goes up a little bit until to the inferior corno of your thyroid cartilage. There, you can palpate it there. And more likely, that is the pointer for you, that location of your recurrent laryngeal nerve. Although sometimes left and right is a little bit, there's a discrepancy, but more or less, it is where that you have to locate down and under. That is your recurrent laryngeal nerve. Of course, you have to find it out during your thyroid surgery for you to preserve it. Otherwise, you will end up patient being hoarse of his or her voice. Remember that. So, recurrent laryngeal nerve coming from the vagus at the inferior portion. At the superior part is your superior laryngeal nerve. Divides into internal and external. Of course, the internal supplies the internal portion of the mucosa, and the external branch supplies the cricothyroid muscle. Okay? So this is another picture of the structures that we are talking about. Okay? Uh, Superior laryngeal nerve. Can you see that at the top? And the recurrent laryngeal nerve. Tanawa. So that relation. I cannot move my cursor. I do not know what happened to my cursor. Can you imagine that? Superior laryngeal nerve, internal and external branch. The external branch goes to the cricothyroid membrane and muscle. Okay, we call it inferior laryngeal nerve. Okay, the superior laryngeal nerve is also coming from the vagus. Now, the recurrent laryngeal nerve is also coming from the vagus nerve, although a little bit inferior. Okay, my cursor again is not really working well. Okay, now the lymphatics is actually our groups of lymphatics in your neck. We have level 1 to 6 actually. That is in particular order and with the significance in terms of prognosticating the disease process of the particular disease, especially malignancy. So these are the level. Just know the level 1, which is level 1, and level 2, level 3, level 4. Know them well because I cannot find some now that is being here to be demonstrated to you. I would suppose that you uh, also have some part to do the readings and not being spoon feed. I usually do not teach student with spoon feeding type. You know, I want you to listen and understand what is being taught, not just reading and memorizing. Okay. Um, from there, we will go to